Nephrotic syndrome is a condition in which the amount of protein secreted into the urine is too high. This condition occurs when there are damage on glomerulus, which is located within the kidney. According to the theory, glomerulus are designed for plasma ultrafiltration. Healthy glomerulus keep the blood protein from being excreted. When damage occurs, glomerulus allow high amount of blood protein excreted in urine, leading to nephrotic syndrome. Minimal change disease, focal segmental glomerulosclerosis, membranous nephropathy, diabetes, amyloidosis, and chronic disease of immune system are conditions that can cause glomerulus damage. Signs and symptoms of nephrotic syndrome include severe swelling, particularly around the eyes, ankle and feet, weight gain due to fluid retention, poor appetite, high cholesterol, high urine protein, which indicated by foamy urine formation. Clinical significance. Due to kidney damage, proteinuria can occur, which then lead to other problems, including hypoalbuminemia, immunoglobulin loss, antithrombin 3 loss, and hyperlipidemia. Hypoalbuminemia is a condition where deficit of albumin in blood as the albumin concentration is below 3.5 gram per deciliter. This condition will result in edema. Loss of immunoglobulin may increase the risk of infection as the immunoglobulin loss into the urine and then act as a potential culture medium for organisms. In the other hand, antithrombin 3 loss can increase the risk of thrombosis as it leads to hypercoagulation. Moving to hyperlipidemia. It is a condition where the lipid in serum exceeds the normal range, which is more than 250 mg per deciliter. This is because liver needs to compensate the hypoalbuminemia condition by synthesizing more protein, which also increase the lipid production. In terms of lab diagnosis, test was conducted on urine and blood sample. In urine test, the sample required is random urine or 24-hour collection. This test was conducted in order to determine the presence of high protein level in urine. In physical analysis, the appearance of urine usually yellow to amber in color, clear, and presence of white foam after shaken sufficiently. Large amount of urine formed due to high concentration of protein, specifically albumin in the urine specimen. In chemical analysis, reagent strip is used. It is immersed in the urine and compared with color chart. In these cases, color change in protein and specific gravity parameter. As a positive result for urine test, protein shown 3+ reading in dipstick, which indicate high level of protein. Besides, it also shown high specific gravity with 1.035 value. Last but not least, 3 to 3.5 urine protein to creatine ratio indicate proteinuria. Moving to blood test, it is performed to evaluate cholesterol and protein in blood. The specimen required is serum and heparinized plasma. Bromocrystal grain method is a test used to measure the level of albumin in serum sample. According to the theory, the albumin will bind with bromocresol dye in acidic condition. The interaction of both chemical will lead to formation of blue-greenish color solution. The color intensity is directly proportional to the albumin concentration. By using spectrophotometer with wavelength of 630 nanometer, it is expected that the absorbance reading is low, which indicate hypoalbuminemia. In the other hand, enzymatic method is a test conducted in order to measure the cholesterol concentration in serum sample. According to the theory, this method requires 3 steps with different enzymes which include cholesterol esterase, cholesterol oxidase, and peroxidase. In final reaction, hydrogen peroxide, which derives from cholesterol oxidation, will react with chromogen to produce pink to red color solution. The color intensity is directly proportional to the cholesterol concentration. By using spectrophotometer with wavelength of 500 nanometer, it is expected that the absorbance reading is high, which indicate hypercholesterolemia. Serum protein electrophoresis test is another method used for nephrotic syndrome analysis by examining the specific protein in blood. In this method, electrophoresis may separate 5 major fractions of protein, which include albumin, alpha-1, alpha-2, beta and gamma globulin. As for nephrotic syndrome specimen, the albumin and gamma globulin shown decreased band. This occurs because both molecules are lost excessively in the urine as their molecular weight are lower compared to other proteins. In the other hand, alpha-1 shown remain unchanged, while alpha-2 and beta globulin shown increase in band. Since both molecules are high in molecular weight, thus they cannot pass into the urine and retain in the blood circulation. The increase of protein synthesis will lead to accumulation of alpha-2 and beta globulin in the blood.